Good morning and welcome back to the Tobago Updates Morning Show. And this week we are celebrating International Men's Day, and as such, all our hosts, all our guests are all men. We're discussing all men's issues. And I have joining me in studio my co-host this morning, Mr. Alex Job Thomas. Good morning, sir. How are you?
Good morning, good morning.
Yes, so we have Mr. Job Thomas in studio today, and he will be ably assisting me in conducting these interviews this morning. In studio, we have with us this morning Dr. Kyle Harracksingh, who is a medical doctor, and he's here to speak to us about the importance of men's health and well-being. Good morning and welcome.
Hi, good morning. Thanks for having me.
Okay, so Dr. Harracksingh, let's get into it. Why is men's well-being important?
So, men's well-being is a very important topic. It's important to recognize the positive contributions that men have done to society, and also recognize that in some ways we are falling short. From a medical point of view, men are statistically, on average, expected to live 4 to 5 years shorter than our female counterparts. So there's room for improvement.
And tell us, you said 4 to 5 years less than our female counterparts. Give us some reasons or some insights into why that is the current status quo.
So globally, men are less likely to visit a doctor, and when they do visit, they usually present with more advanced symptoms or disease than females. So one of the tools we recommend is early screening.
And how can we go about getting men to seek medical attention more regularly so that these kinds of scenarios don't show up?
So part of that is awareness. So programs such as this that encourage men to seek medical attention would be important, and recognizing the value of screening. So unlike the standard medical process where a patient comes in with a problem that needs a diagnosis and treatment, screening kind of flips that on its head. So we look for problems based on decade. And then by looking for these problems, we can hopefully pick up on it earlier rather than later.
And what are some of the more prevalent diseases and illnesses you see men presenting with in your experience?
So men often come in with elevated blood sugar, elevated blood pressure, and high cholesterol. And it's important to recognize that these don't always have symptoms. So, we'll often, let's say, see a patient and recognize that their blood pressure is high. And then we realize, okay, maybe there's something going on long-term and chronic as opposed to an acute cause. Now, they don't necessarily have symptoms. So a patient may not come to us and say, my blood pressure is high today.
Yeah.
They might come for some other reason and we happen to pick up on it.
Right.
Yeah.
I know one major problem many societies having is pride. They think that they learn in their lifetime growing up, they have to tough it out, right? And coupled with that, with the sometimes some symptoms don't show. How do you get them to, from your perspective, how do you get them to see the value with that pride factor involved?
Yeah, so it's important to recognize that pride is a factor, and phrases like "take it like a man" and "toe the line" are influential. But education, let patients be aware that these things are important and that it's better to have a conversation and talk about changing our diet and exercising more rather than waiting for something bad to happen to then need to start the medication. So, education really.
And in the Tobago space, apart from the testing beforehand you mentioned, are there any other initiatives to really seek men's health, take care of men's health? For example, the Blue Room. What sort of initiatives are taking place at the Blue Room that men could go and get assistance up there?
Yeah, so the Blue Room is really focused on screening and men's health. So they would check, let's say, blood pressure, do certain blood tests to really pick up on things before they get out of hand. So yeah, that's one of the positive initiatives that men could take, in addition to some of the lifestyle advice we like to give. So quit smoking, decrease alcohol, decrease salt intake, and eat more vegetables.
even when men do get diagnosed with, let's say, it could be a non-communicable disease or perhaps a cancer, we know prostate cancer is prevalent. How difficult is it, in your experience, to get men to follow medical advice that is in their best interest?
Yeah, so it can be quite challenging, but it is important to always highlight that when something is detected early, the treatments are less invasive and outcomes are more favorable because you've picked up a problem before it's gotten more advanced.
That you may not need invasive surgeries, you may need a minuscule surgery, minor surgery, or probably just medication or lifestyle change, that kind of thing. And as I mentioned, lifestyle change, men who like to smoke, they like to drink a lot, and it's causing them to become ill. In terms of changing those lifestyles, the men's openness to changing lifestyles, is that also a factor in leading to men dying 4 to 5 years beforehand?
It certainly is a factor, because at the end of the day, we can counsel patients and tell them what to do, but men have to recognize that we're saying this in their interest because we want to, we've seen it many times, where an early intervention could prevent something 5, 10, 20 years down the line. So yeah, recognizing the vulnerability, which is hard for us to do as men, but accepting that and saying, okay, how can we make changes to improve outcomes?
All right, so in the Tobago, I know my co-host alluded to the Tobago context. One of the problems that we have is a confidentiality problem. When men go to the blue room, how are they assured that the information wouldn't get out there? Because they lead back to the pride problem, but confidentiality because they don't want persons doing their business, which is a important point, and they have a right to be private. The confidentiality in terms of the men on the island and accessing the different initiatives.
So confidentiality is an important part of the healthcare process, and being confidential is important because we know it's difficult for patients to come in and ask for help many times. So yeah, it's certainly something that we take seriously, being confidential and assuring patients that the information isn't going to get out there as best as we possibly can.
So we're talking about men's health right now, and we are still on the angle of physical health. But in terms of the men's mental health as well, how important is it to men to maintain a good mental health?
It's very important. So maintaining a good mental health could be as simple as having conversations with supportive family members and friends, and in other cases, maybe seeking professional help. Men often are the breadwinners and suffer burnout. So it's important to recognize when we do need to take breaks and when we do need to have those conversations and say that, maybe not everything's all right now. And then take it from there and see what help could be available.
I know that persons seeking mental help is a very difficult thing for most persons to do. But have you experienced that within men, it's even more difficult than to get them to come to that point of seeking help than it is with women in terms of their mental health?
Yes, so from a cultural point of view, not just for Tobago specifically, but men globally, it is recognized that men often don't want to be in what's called the sick role, having to come forward and ask for help. But it is important to recognize when we do need help, and asking for it is one of the first steps into getting it.
And what are some of the things that men can do to really ease that burden? Let's say they don't want to go to a therapist or a counselor or anything like that. What can men do within themselves, for themselves, to really ease that mental stress that they may be feeling?
So not everyone would require a therapist or a psychiatrist or a psychologist. One of the first steps is having an open, honest conversation with their peers, with their colleagues, their co-workers, their family, their friends, wherever it's appropriate. But it is also important to recognize that not everyone has a friend they could talk to. Not everyone has a family member that's supportive. So sometimes we do need to recognize when we need to go to the professionals.
In those certain circumstances where people don't have anybody that they could talk to, can they talk to themselves? Is that something that you would advise persons to do? Or should they actually go and seek out someone else, a professional, a counselor, a therapist, some kind of thing, some sort of professional rather than talking to themselves?
So that would be more on a case-by-case basis. But yes, certainly talking to themselves and, meditation, deep breathing, all these techniques would help. But it's important to recognize that, just like how a construction worker might have different tools in their tool belt, talking to yourself is one tool, but then also there's family and friends, and then of course professionals. So it'll be more on a case-by-case basis.
Okay, and in your experience, when you all recommend to men to really seek out that sort of mental health, because somebody might come in for a medical issue, but you realize that they also have mental health issues. You may refer them. What are the responses like from those men that you may refer to the psych ward or the psych unit for assistance?
So I don't have any statistics offhand to comment on that. But we do try our best to refer appropriately, and we hope that there is adequate follow-up. It's important to recognize that when we refer someone, we would give them their letters, their paperwork, and we recommend that they go. But they still have to take the initiative to then follow through with it. So it's important to recognize that it is a problem and follow through to get the help and support that's needed.
One of the problems I think men have with seeking mental help is that they very often don't come to the realization that they actually need the help. They just think that the circumstances in which they're operating is normal, or it's something that they just have to bear with. So what are some of the things that men should be looking out for to come to that realization that everything is not all right? I need some help. I need to take care of my mental health.
So sometimes men might come in and be a bit more angry than normal, or may just feel these strange body aches and pains that they can't explain. And they would come to us for some medical advice, and then once we've ruled out every organic cause, recognize that it's likely something mental in nature. From there, we'll have a further discussion and look into, okay, well, what might be the stress event? Maybe it's something at work, maybe it's something going on with the family. So, yeah, it's important to recognize that it is an important topic. You had mentioned an interesting word there. You said the word normal. Normal for us as people is our average. So if you've grown up in a house, in a community where people are always stressed, to you that is normal.
Right.
And I think it's important to recognize that awareness days like International Men's Day is a way to highlight that there are some stresses that men face, and there are positive role models in society. So we can hopefully change what normal means.
I know that we've been focusing on men and how men can help themselves, but also the women in these men's lives are very influential as well. What are some of the things you would advise women also to look out for? How can women also assist in terms of being an ally in helping or improving men's health?
So open, honest conversations. It's very tempting when someone asks the question, how are you going? To just say, everything's fine, or I'm good. But it is important to sometimes say when things aren't good. So yeah, when women could talk, whether it be with their husbands, their partners, and have those conversations, they can offer support before things get out of hand.
Okay, all right, thank you very much, Dr. Harracksingh. Viewers, we have to go for a short break, and when we come back, we continue our conversations. So do us a favor, share the live, share the live, share the live. We'll be right back after these messages. Welcome back to the Tobago Updates Morning Show, and we continue our conversation with Dr. Kyle Harracksingh, who is a medical doctor, general practitioner, and is here to tell us about men's health and well-being. So let's continue the conversation. So you were talking about screening. Just try to break it down for us in terms of what this screening looks like and what you're looking for?
Sure. So with screening, it's decade specific. So for example, when patients in their 20s to 30s, we would look more at their blood sugar, their blood pressure, their weight, their fitness, and do what's called testicular checks. From the 40s go up, we look more at cholesterol, we look at prostate, and we also look at colon screening. And then from the 50s, it's everything as before, but we include looking for diabetes, kidney health, eye health, and heart health.
Okay, and in your experiences, have you seen any successes or heard of any successes with these screenings?
Yeah. So I actually have a personal friend of mine who is a medical doctor, and he was just scrolling through Instagram, and the feed kind of suggested him a video that highlighted testicular cancer and talked about the importance of, self-examination. And it's important to recognize that the highest incidence of testicular cancer is from the age 20 to 30. So he self-examined and he felt a lump, and he then got an ultrasound that showed a shadow. And when he went and did the surgery, it found an early testicular cancer. So simply by screening and checking himself, he was able to recognize something before the problems really arose.
Okay.
Well, I just want to point, well, I understand the experience that your colleague had, right? But I will say he's an outlier. What about the regular man on the street? Do you think that they will go for screening such as that, 20 to 30s?
No, so it's certainly not common, but it is important to recognize that if we could pick it up early, to the next patient who ends up with advanced cancer, if they could find out that, look, by checking it earlier, this thing could have been prevented, controlled earlier, or even if surgery was needed, an easier surgery with a higher chance of recovery, they would want that option. So it's important to have talks like this so that patients can go for screening and doctors can mention screening so that it can be done.
So in your experience, what would you say is the importance of public education in changing persons' mindsets towards seeking out early medical attention, screening, just having a general better attitude towards maintaining their health?
Yeah, so awareness and education is important because we only have one body. We have to take care of it. And if we can pick up problems early, then we can have better outcomes. The same way how we'll check our car and realize we need to get more gas before the gas runs out.
Yes.
It's important to check these things, check blood sugar, check blood pressure. And once we could pick up problems early, we can intervene and have better outcomes, rather than waiting for a problem to then come and try and figure out what the problem is, to then start treatment.
So we're talking about all the screenings and the testings and public education and all of that. What do the numbers look like from your experience? You work at the Roxborough Hospital. But what are the numbers really looking like in terms of men really coming forward to get these screenings and these tests done on a regular basis?
So I don't have any numbers offhand to talk about screening, but we do have the number of the outcome. The outcome being men live 4 to 5 years shorter than women on average.
Right.
And a big part of that is the delayed presentation. So I can't give us very specific, but if you were to add up everything, that's the final result.
But in your anecdotal experience, your personal experience as a doctor, how regularly do you see men coming in to do these screenings, to do these testings, that kind of thing?
Not as often as I would like. Not as often as I like. There are some patients who come for their annual medicals and they would come for the screening. But the vast majority of patients come because of a problem rather than coming to check to prevent a problem.
Right. So these things cost money sometimes. And that might be a deterrent, yes. That might be a deterrent in terms of men going and seeking medical help. I remember have this anecdotal story about this man. He was diagnosed with prostate cancer. And the cost of him doing the the medical treatment for it was about $60,000. And the man literally chose to die instead of incurring the cost because the cost would have been passed on to his family. So he literally chose to die instead of letting his family go through that finding $60,000 to pay for him, and then they got to pay back the loan. They're not even sure if he will survive and all of that. And so the real question I'm trying to ask you is, are all of these screenings available to the public free of charge in the public healthcare system, or are some of them have to be done privately?
So they're both available publicly and privately. But it's important to recognize that the screening should be done because we can pick up things earlier. But no, to answer your question, yes, it can be done both publicly and privately.
All right. You have anything else you would like to share with the public concerning men's well-being, men's mental health, men's physical health that you would like to share with the public?
Yeah, so I think days like tomorrow are important where we could recognize this and carry it throughout the year. So even though there's one specific day of recognition, being able to talk about it, being able to encourage screening, this will help hopefully close that 4 to 5 year gap that we currently have.
All right, thank you very much, Dr. Kyle Harracksingh, a medical doctor, and he was here speaking with us about the importance of men's health and well-being. Viewers, we have to go for a short break, but when we come back, on the other side of the break, up next, we're going to have Francis John, who's an artist, a songwriter, and entertainer. And he's going to be speaking with us about men in art. So do us a favor. Share the live, share the live, share the live. We'll be right back after these messages.